Good day, everyone. You're welcome to another edition of my program called Health Talk with Queen Nikki. Health Talk with Queen Nikki. How you guys doing? You're welcome to another teaching program of mine. Have you subscribed to my YouTube channel? Well, the handle is called Health Talk Queen One. Health Talk Queen One. Turn on the post notifications, subscribe, and follow me on YouTube so you can get notified when I drop a yummy new video. Have you follow me on TikTok? My TikTok handle is called Health Talk Queen. Health Talk Queen. Follow me also on TikTok so I can follow you back so you can share my program reports, like, comment, so other people also can benefit from it. Who can guess what today's topic is going to be? Today's topic is a very important one and it's called prevention of UTI. What is UTI? UTI is simply urinary tract infection. This is common with both male, female, young, old, name it. Yeah, it's the common infection that usually we get. So I'm going to be talking about it today. So let's dive into it. What is the definition of UTI? This is when bacteria enter our urinary tract, from our body to the urinary tract organ itself. Now, let me tell you, our urine can be the most sterile liquid in our body. When we urinate, it's the most sterile, but once it's affected with infection or bacteria from our body into the urinary tract infection, this is where we get the infection that we want to talk about. Okay, so what are the symptoms that we need to look out for when we start seeing this infection going on? So let's go to the symptoms. First, we will see painful area. So painful area, it might be your pelvic area might be so painful, the groin area, the bladder area, the lower abdomen, and the pelvic area. This is going to be very painful, especially when that individual with this infection is using the bathroom. Also, they will have painful urination. When the person that is affected with UTI is urinating, it's very painful, especially when they are peeing or using the bathroom. It's very painful. Another one is foul smelling, especially when they urinate. It smells so like a dead chicken. That's how it smells. Foul smelling. And also it's cloudy most of the time. Sometimes it can be cloudy. Sometimes there might be blood in it. Sometimes it might be very it's not going to be clear. It's going to be really cloudy, like like cheese. When you put cheese in the water, you see how cloudy it might be sometimes. Or that's how UTI is. Sometimes some patients also experience frequently. They frequently go to the bathroom, or sometimes they want to go but they can't go. They can't go. It's very and sometimes when they empty their bladder, it's not totally empty. That's sign of UTI. And the body, they become fatigued sometimes. This is towards the end stage. They become fatigued. Sometimes patients with UTI, they have fever and body pain all throughout. And they sometimes they get so crampy, and most of the time for the female, they have vaginal infection. So if you are experiencing this sign, please make sure you get it checked out. It might be UTI. The end stage is always fever. That's why I said when a baby have a fever, please let's make sure we look at other signs, because it's very common for a baby, especially the toddler. When I mean the toddler that are still potty training, to have UTI is very common. So if you see them experiencing this symptom, please take them to the primary care doctor. So now let's look for the reason why we have reoccurrent UTI. Like I said, this one that I'm about to say, it can be for adult, it can be for baby, it can be for teenager, it can be for male, female. So why do we have reoccurring UTI? Number one, when we are using hash soap or spray when we are using the bathroom. You know how we wash ourselves under when we finish using the bathroom? If we are using ash soap or spray, it can cause UTI. Also, poor hygiene. Poor hygiene means sometimes some people, when they use the bathroom, they don't clean up properly. Like sometimes some people clean up from from back to front. That's no, no, no. So, and I will tell you when I get to prevention the proper way to clean up. Sometimes some people, they don't wash their hand properly, and then they go with the same hand to wash their self underneath there. So improper hygiene can also cause recurring UTI. When we wear tight clothes under, like tight underwear, it can cause UTI also. Not drinking enough water, yes, can cause UTI. When you're not drinking enough water, it can cause UTI. Also, holding urine. This is very, very common with we nurses, because we have, ethic shift. We hold urine. If you're holding your urine, yes, it can cause UTI. So you don't want to do that. Okay, so now let's go to prevention. This is where I love prevention treatment for UTI. If you have urinary tract infection, what are the things you need to do? Let's go right into it. I'm always happy when it comes to prevention, because as a nurse, teaching is our number one priority. So let's go. Number one, stay well hydrated. I talk about, why do we have frequent UTI? We said lack of hydration. Now, you need to drink a lot of water, at least 16 ounces of water per day, water, mainly water. Now, if your alternative is carbonated drink, now when I say carbonated drink, I don't mean carbonated, I mean acidic drink. Acidic drink mean like your citrus drink, like your citrus food, like tomatoes and what's it called? Tomato beverages. You can drink that, and cranberry juice. Cranberry juice is very good for UTI. Once you drink it, it acidifies the area, the pH of the urinary tract, and it makes it more very acidic for bacteria to grow in there. So make sure you drink your cranberry juice. Make sure you drink your 16 ounces of water. And for kids, encourage them to drink more water very well. And also alternative cranberry juice. The next one is take shower instead of bath. You know how we sit in top bath to relax ourselves? Yeah, it can increase risk for UTI, but instead, in alternative, let's stand up to take shower. It reduces and reoccurrence of UTI, and it prevents us also. The next one is when we are cleaning ourselves, especially the female. Please, let's make sure we teach our children to clean from front to the back. Let's say this is our under. Okay, tell them to clean from front to the back when they are using the bathroom, or after they use the bathroom, clean from front to the back. So that way, the infection will not go from their anus area down to the vagina area. That's what I mean. It's very, very important. Let's teach our toddler, especially the 3-year-old, 4-year-old, the proper way to clean themselves, and also wash their hand after they use the bathroom. The next one is also for we intimacy, like adult, after we finish having sex, please make sure you urinate immediately. It also prevents UTI. It prevents UTI. And if you have tried all this and the UTI is still there, please make sure you seek your primary care doctor advice so they can give you medication and also what to do next, okay? Especially for fever, so they can treat the fever, or also give you a long-time antibiotic whereby you can take it, or if you need further IV antibiotic, they can do it. I hope this helped, and I'll be able to see you in my next episode of UTI. Please watch my page. I'll be downloading more PowerPoint for you to also use as a reference. Till I see you guys, remain blessed and subscribe to my YouTube channel, Health Talk with Queen Nikki. Health Talk Queen 1. Health Talk Queen 1. Bye.